All right, today we're going to explain the physical exam process and why we do what we do. And there's a lot of things that I think the average client or dog owner or cat owner does not realize that we're looking at. So we're looking at body systems essentially to make sure that they're normal. So one thing that is very logical is just to watch the animal move around the room. Do you see normal placement of feet? Do you see any instability in their movements in the gait? Is the head in correct relation to the body? Is there a head tilt or anything like that? So those are all things that you may not realize we're assessing, but we start looking at an animal as soon as we come into the room. So this is Brownie. Yeah, you're a good old dog, Brownie. Yes, you are. So we'll start with the head here. Let's move him out of here a little bit away from that.
Here we go.
So, well, turn him to the camera there.
Well,
All right, so we're going to look at his eyes,
that tail.
and we're going to do that with my unaided eye, but also use an ophthalmoscope here in a second. We're going to check out his teeth, smell his breath, and we use all our senses: sight and feel, touch, smell, hearing. There you go. So check out all the oral cavity. And we're palpating the head, feel any lumps or bumps that should not be there, including lymph nodes. There are several lymph nodes under the skin that we can palpate if they are too enlarged. So get some of our instruments here. And here's an ophthalmoscope. So we're going to look more deeply into the eyes. There you go, buddy. Oh, so we're looking through the cornea, and if there are any opacities, any things that would block the transmission of light through the cornea, we'd be able to see that. But we can also look at deeper structures within the eye, where the nerve comes in, the vasculature, the blood vessels, things like that. And Brownie's eyes look great. Now we'll look more closely or more deeply into the ear canals. And with an otoscope, the ear canal is called the otic canal, O-T-I-C. So with an otoscope, we can look into that canal, but also we want to see right down to the eardrum itself. And Brownies look fine. So now I'm going to start palpating or feeling. In fact, let's turn him around. There we go. Good dog. So now let me get in here. I'm going to start palpating the body, and I'm making sure that the left side of the body is the same shape or symmetrical to the right side of the body. And I'm feeling for any lumps or bumps, and including the lymph nodes I mentioned earlier. Yeah, that feels good. Okay, while we're doing that, we're also assessing the feel of the coat and the appearance of the coat. And so I'm kind of separating the hairs here, looking at the skin itself as I do so. And this is one means of picking up evidence of a flea infestation, for instance. But dandruff, inflamed skin, things like that. Okay, well, since you're down here, let's check out your hip and knee and ankle range of motion, and whether there's any popping or creaking in those joints. So his hind limbs seem to be fine. Brownie, let's get up. All right, let's check out these front limbs here. There you go. Now those lymph nodes I mentioned, there's some under the chin here, the mandibulars. There's some ahead of the shoulder, the prescapulars. In the armpit, those are called axillary lymph nodes. In the groin, those are called inguinal lymph nodes. And then right behind the knees, those are called popliteal lymph nodes. And all his lymph nodes palpate normally. Okay, so I'm going to listen to the heart and lungs. Now, listening to the lungs tells us whether there's any abnormal sounds there. And we should also listen to the upper respiratory, or the trachea and the the air moving through the head.
Okay. Oh. Okay. 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 Let's go.
Okay, now another thing that the stethoscope can be used for is to assess the bowel sounds. So normal and healthy intestines are moving on a regular basis, and there's gurgles and squishes associated with that movement. And I like to hear those. Unhappy guts tend to be quiet guts, so I'm always happy to hear those normal bowel sounds. So anyway, that's just kind of a quick and dirty explanation of what we do on a physical exam. And hopefully that helps to explain some of the value that you receive as a pet owner bringing your pet here to Pet Medical Center. So thank you.